Hello, my name is Dylan.
I'm Stav.
I'm Jordan.
And I'm Ian.
And this is our NUR1205 group presentation on homelessness.
Homelessness is a significant issue worldwide. There are currently 105,237 people living in Australia without stable accommodation, with 22,773 people in Victoria. This means roughly 1/5 of the whole homeless population is from our state. So as you can see here, Victoria is sitting at the second highest rate of homelessness. We've got New South Wales first, and obviously the smaller states have the lower population. There are varying degrees of homelessness. Some people rough it on the streets, living in parks or wherever they can find shelter. Some find themselves frequently moving from shelter to shelter, and others find refuge in boarding houses or long-term accommodation. The issue with most of these supported accommodations is that they can get severely overcrowded and lead to physical, mental and social health issues. So there has been a shocking 74% increase in homelessness just within the CBD over the past few years. This significant increase has caused strain on community and government services to provide these citizens with the proper resources and support they need. As a nursing student, it is important to understand, without judgment, the dynamics of this vulnerable population group in order to combat the significant health issues they face.
Homeless people are a vulnerable population and suffer many health issues. These include mental illness, physical illness, and disease or infection. The homeless population do not own a place to seek shelter and are therefore exposed to many harsh conditions that the general populations do not. Melbourne is known to have extremely hot summers, and during this period the homeless populations present to the emergency department with dehydration and heat stroke. Their inability to seek shade and find suitable drinking water leads them to these harmful conditions. Homeless are also particularly vulnerable to insect bites, which carry diseases and cause severe skin irritations. Venous stasis from prolonged sitting or sleeping leads to edema of the peripherals with ulcers and cellulitis, which further damage and weaken the surrounding tissues. People who experience homelessness are less likely to seek healthcare services than the general population. Common reasons for avoiding healthcare include greater priorities, food, shelter, poverty, low healthcare literacy, and distrust of the medical department. Many homeless citizens report a perceived stigma when they seek help, leaving a feeling of discrimination and distrust of the medical department, further complicating this issue. For this reason, many conditions that could have been cured worsen, and the condition becomes severely debilitating and lifelong. Mental illness is another common problem for the homeless population, which stems from a lack of community support and previously bad experiences. Providing long-term treatment outside the hospital care is also difficult to achieve, and patients will often disband from further care. The homeless experience this downward slope where it's difficult for them to receive the care they require, and they will decline further into a worsening state. Injuries such as bruises, strains and other forms of trauma are commonly reported in the homeless group. They have no protective shelters that shield them from the outside world, and they can be subject to frequent vicious acts such as assault, rape and robbery. Drugs and alcohol abuse occurs in some homeless groups, and these additional risk factors predispose them to chronic respiratory problems due to a weakened immune system. These risk factors can be a reason for the homeless or used as a coping method to try and deal with their homelessness. Many individuals in this population group experience issues affecting their social health. Their living arrangements and low socio-economic status leads to an increased difficulty to develop and maintain personal relationships. Their ability to interact socially with other individuals is hindered by stigmas and prejudice held by the community. The stigma surrounding the homeless population leads to the avoidance of social interaction and the want to approach supports. Their standard of living and inability to access vital resources often put not only their social health at risk, but their mental and physical health as well.
So I'll be talking about the approaches and interventions that the government, community or other stakeholders are taking to improve the health of individuals experiencing homelessness. The Australian government recognises that homelessness is a complex issue that is affecting many across the country. Homelessness is an issue that requires long-term and systematic effort across agencies and community services. So the Commonwealth supports both the state and territory governments in their role of providing services to the homeless population through the funding of the National Affording Housing Agreement, or NAHA, and the National Partnership Agreement on Homelessness, or NPAH. The NAHA commits to achieve certain goals such as helping the people experiencing homelessness by providing sustainable and affordable housing. The NPAH contributes to the goals set out by the NAHA, however, it is funded separately and aims to fund frontline homelessness services. So the community services include the Reconnect program, which is a community-based intervention service that assists young people between 12 and 18 years old that are experiencing homelessness as well as their family. So the Reconnect program helps to stabilise young people by improving their engagement with their family, work, education and community. In 2015, around 90% of young people reported to have an improved situation after being assisted through the Reconnect program. So the HPP, or Homeless Persons Program, gives individuals experiencing homelessness access to community health nurses. It is made up of specialised community nurses and aims to provide holistic care to the homeless and improve their access to general community services. The Australian Red Cross is a well-known community service that provides support to individuals experiencing homelessness by helping people maintain their housing. The Red Cross also encourages people to live as safely as possible, develop pathways out of homelessness, build life skills, as well as providing information, resources and meals. The Salvation Army offers a 24/7 homelessness program, which is a community response team that responds to the homeless crisis situations that are based in Melbourne CBD. It mainly acts as a point of contact and resource that will help to assist individuals in connecting to the other Melbourne-based services. The Ozanam House is a service that has provided accommodation to single men over 18 that are experiencing homelessness or a housing crisis in the inner Melbourne region. They provide accommodation and catering services as well as volunteer and community development programs.
So the last service is a living room, which is endorsed by the Youth Project, and they focus primarily on the social determinants of health, as well as having an aim to help transition people from homelessness through sustainable, empowering solutions. Individuals can visit the living room for free showers, laundry, food, phone calls, internet access, and if so desired, they can also watch a movie or listen to music playlists.
We came up as a group to address homelessness. We indicated that a key issue was to help to maintain housing and avoid homelessness. So in terms of this, we thought that providing individuals who are suffering from this issue to give them sustainable accommodation and the life skills to enable them to make rental payments. Another issue we believed was a possible solution was building life skills and community connections through education. So we indicated first aid practices that they can use and also sustainability of these practices to break through issues that are associated with it. Another issue we thought that was a possible solution that we can address was to support people on low incomes or experiencing housing problems. So, yeah. Overall, collectively, we came up with the idea that these solutions will move away from the cycle of homelessness. Although these ideas have been put into motion through interventions of government policies and practices, they just need to be amped up a little bit further to reduce the rate of those who are suffering from this.